In this session, we are going to describe the anatomy of the submandibular region, starting by the layers of such region which extends below the mandible down to the body of the hyoid bone on each side. We are going just to say that to describe the layers when you reflect the skin during any surgery or exploration of the lesion. From the skin down to the different layers as we reflected to reach the cavity of the pharynx. That is what we are going to do in that session. So this is the submandibular region, which forms the floor of the mouth most of the structures and contain important structures, nerves and vessels, mainly the submandibular gland and a good number of some cranial nerves. So what we are going to do now is to start to summarize the layers of such region. Before that, we need to know the main features of the mandible, which is the skeleton attached to it. All the structures are related to it, all the structures in that region. We need to know the main features of this bony mandible. Here is the two views from the front and side. That is the alveolar border, which carry the teeth above it. That is the border here. And these are the well-developed teeth. And then that is the mental protuberance, which is a meeting point between the two halves of the mandible, which unite early in childhood, around the second year. That is the mental protuberance. On each side, there is two mental tubercles, one on each side, here and here. And that is what called the base of the mandible, the lower border. That is the upper border or alveolar border. That is the lower border or the base of the mandible. Then that is what called the body. Of course, the other part will be called the ramus. That is the inferior border of the ramus here on this side, on the right side. And that is the head of the mandible. That is the neck of the mandible. Both of them are called condylar process. That is the angle of the mandible, the meeting between the posterior border of ramus and the base of the mandible. That is the anterior border of the ramus, which will continue in the body by forming the oblique line of the mandible, which we have seen it giving origin to the buccal muscle. And here is the posterior border of the ramus of the mandible here. That is the posterior border. And that is the mental foramen, which carry or give passage for the mental nerve and vessels from the inferior alveolar nerve vessels, and this connected with the mandibular canal on the side of the body and ramus of the mandible. That is the ramus itself. Yeah, here we are looking to the mandible from behind. That is the posterior aspect of it, and that is the side of the inner aspect of the ramus of the mandible. Here we can see the crinoid process, the mandibular notch, and the condylar process, which is formed of the head and neck, as we said. That is the upper part of the ramus. We can see the mandibular foramen here and on the other side here. That is the mandibular foramen here and here. And then that is the regoin fossa on the inner aspect of the neck of the mandible, which will give attachment to the lateral regoin. That is both the superior and inferior genial tubercles on each side of the middle line of the fusion of the two halves of the mandible, as we said early in childhood. The upper one will give origin to the genioglossus muscle. The lower one will give origin to the geniohyoid muscle. Of both sides, there is two tubercles, one on each side, here and here. The mylohyoid groove, that is the mylohyoid groove, which give passage for the mylohyoid nerve and vessels, branches of the inferior alveolar nerve and vessels. That is the submandibular fossa, which lodges the submandibular gland. Above is the mylohyoid line, which give origin to the mylohyoid muscle. And this is the digestive fossa on each side of the middle line here. That is one here and one here. That is the digestive fossa, will give origin to the anterior bit of digastric. That is the sublingual fossa, which lodges the sublingual salivary gland. And this is the lingula here, which give attachment to the sphenomandibular ligament from the spine of the sphenoid to the lingula over here. Now, the important point is the vessels and nerves related to the mandible, which is a very important point to take care when you are making any surgery or maneuvers with the mandible, either with the dentist or the surgeons. These nerves and vessels can be injured during those maneuvers. So we have the mylohyoid nerve and vessels, as we said, in the mylohyoid groove. We have the facial artery in two positions, in the outer surface at the base of the mandible, as it crosses to reach the face at the anterior angle of the masseter muscle, and also it lies between the inner aspect of the mandible and the submandibular gland in that area. That is the facial artery. The mental nerve and vessels will come out through the mental foramen here as branches of the inferior alveolar nerve and inferior alveolar vessels. That is the marginal mandibular branch of the marginal mandibular branch of the facial nerve. Again, it is a very important nerve as it supplies these muscles of the face here and the platysma, which is a very important with the cervical branch of the facial nerve. That is the masseteric nerve and vessels, which pass through this mandibular notch to the masseter, which lie on the outer surface of the ramus. Auriculotemporal nerve and maxillary artery are related to medial side of the neck of the mandible, which again is a very dangerous position in case of dislocation of the temporomandibular joint or fracture of the neck of the mandible. That's the most common fractures can occur in the mandible. The inferior alveolar nerve and vessels as they pass through the mandibular foramen to the mandibular canal. And lastly, the very important nerve in relation to the last molar tooth is the lingual nerve. In that groove, you can see that groove here. And this is a very important, nerve in relation to extraction of the last molar. Not usually, it should not be injured during extraction. This nerve at that site is covered only by mucous membrane, and you can roll it against the bone if you pass your finger behind the last molar. These are the important nerve and vessels in relation to the mandible. The last point about the mandible is the age of the mandible. We have it in childhood, in adult, and in old age, and we depend on three main differences. The angle between the ramus and the mandible. In the childhood, as you can see, it is obtuse angle due to the non-development, complete development of the alveolar border and the teeth at that age, and the backward direction of the ramus. In the adult, it's almost right angle due to the well-developed of the alveolar border and the teeth. In the old age, it is again obtuse because of the absorption of the alveolar border and fall of the teeth at that age. The second is the alveolar border itself is not well developed in the childhood. It is very well developed in adult with the full teeth around. At the old age, it is almost absorbed because of the loss of the teeth. But the most important factor which we depend on to determine the age of the mandible is the mental foramen. In childhood, it is near the base due to the development, the difference of development of the upper and the lower part. The lower part is not well developed. In the adult, it is almost in the middle due to the development of full development of the mandible now. In the old, it is at the upper border due to the absorption of this alveolar border. If you remove this part here, the mental will be at the upper end. So that is how we differentiate between the different ages using the mandible. Now, that is the mental foramen here, that is the mental foramen here, and that is the mental foramen in the old age. Let's go now to the submandibular region, which we are said we are going to try to summarize the layers of that region, and this is the best way to understand the anatomy of that region by knowing the layers of that region. I will try first to enumerate those layers, and then we'll go some cadaveric specimen to show those parts which we have included in the summary, and lastly some other diagrams which will help to orient that region. So that is the layers. Let's enumerate the layers first. The first layer, you will start by the skin, the superficial fascia, which contains the platysma, which contain also the submental lymph nodes, and mandibular and cervical branches of the facial nerve. These are the main important contents of that area. The anterior facial vein will be almost just starting to be formed, and one of the facial vein to join the anterior branch of the retromandibular vein will be in the most posterior part of the region. Then the deep fascia, then the digastric muscle, and the substylohyoid muscle, which is fixed to the posterior bit of digastric, and lastly the superficial part of the submandibular gland. So now we remove the skin, the superficial fascia, the deep fascia will be facing the submandibular gland, which overlaps the digastric muscle. That's what we call it the first layer. The second layer is the structure related to the mylohyoid. This is the submental vessels, the mylohyoid nerve vessels on the surface of the mylohyoid. That's when we remove the submandibular gland, superficial part, and we remove the digastric, will be facing the mylohyoid muscle with those structures on its surface, superficial surface. Now, the third layer, which contains a good number of structures, and those structures are mainly deep to the mylohyoid and superficial to the hyoglossus muscle. A good number of structures are here. When you just reflect the mylohyoid, now you can see the hyoglossus, the styloglossus on the surface of the hyoglossus, the genioglossus, and the geniohyoid coming from the genial tubercles of the mandible. These are the muscles which you see deep to the mylohyoid, or included in the third layer. There will be the deep part of the submandibular gland, which lies between the mylohyoid and the hyoglossus, again on the surface of the hyoglossus. That is the duct of the mandibular gland will be there. The hypoglossal nerve will be there between those two muscles. The lingual nerve will be also there. The suprahyoid vessels, the sublingual gland, the third part of the lingual artery on the surface of the hyoglossus, and the deep lingual vein. These are the structures which you can see, or you will see, when you reflect the mylohyoid to look at the third layer. When you reflect the hyoglossus, now you will see the fourth layer, which is formed of the stylopharyngeus, the glossopharyngeal nerve along its lower border, the second part of the lingual artery, the stylohyoid ligament as arising from the tip of the styloid process, the genioglossus muscle, and the geniohyoid muscles again will be there deep to the hyoglossus. So this is the fourth layer. So if you remove, and at last will be the middle constrictor, which is part of the wall of the pharynx. If you remove now the middle constrictor and those muscles, you are in the cavity of the pharynx. So these are the layers which you have to follow when you are exploring this region. Let's start by those cadaveric specimens. That is the first one, which show some of the superficial, or the first layers have been removed, the skin, the superficial fascia, and the deep fascia. Now you can see the anterior bit of the gastric. You can see the submandibular gland, which we are going, this what we call it still with the first layer. That is the facial artery, which goes to the face. That is the posterior bit of the gastric, very posterior. And that is the external carotid artery, low down in the neck. And that is the suprahyoid artery. So that's what we can see here. When you remove the skin, superficial fascia and deep fascia, then we'll remove the digastric and remove the submandibular gland with the facial artery. That is another good specimen for the first layer. That's what we have seen. We have seen in the first layer also we remove the skin, superficial and deep fascia to see the digastric muscle and the submandibular. The most posterior part will see the facial vein, the third division of the retromandibular vein forming the common facial, going to the internal jugular. That is when you remove that gland and that muscle, the digastric. Now we are go to the second layer. Let's see this one. That is the anterior belly. That is the superior belly of omohyoid. That is the submandibular gland. That is the facial artery. That is the hyoid bone here, which limit the lower border or the lower level of that submandibular region. That is the anterior facial vein, and that is the anterior division of the retromandibular. That is the common facial, and all of them are going to the internal jugular vein. That is a specimen. When you reflect the skin, superficial and deep fascia, you will be facing this layer. The second layer here, after reflection of the mylohyoid, you can see what we have done. As we said, we remove the digastric and the submandibular gland as the first layer. We'll be facing the mylohyoid muscle here and the structures superficial to it, which are mainly the submental vessels and the mylohyoid nerve and vessels supplying that muscle. That is the second layer here. That is the second layer. Now we are looking to what is deep to that second layer here. We can see the submandibular gland. We can see its own duct here. We can see the lingual nerve. We can see the hypoglossal nerve. We can see the facial artery again. We can see the mylohyoid muscle as reflected. The anterior digastric reflected again. We can see the hyoglossus muscle here. And if we to see the other parts here, I will say this is the third and this is the deepest layer here. Here you can see the ramus of the mandible have been removed. I mean the body of the mandible, that is the cut edge here, and that's the cut edge to expose these structures. And this is the deepest layer where the ramus again has been formed, has been removed. I would like you just to orient the structures here. They are mixed between the layers. We have summarized the first, the second, the third layer, what you can see. But in these cadaveric specimens, there is a mix between those layers. So because you cannot just get it as one layer here. Now you can see the styloglossus muscle here and the styloglossus muscle here, which come on the surface of the hypoglossus. That is the hypoglossus muscle here, where the lingual nerve is superficial to it. So you can get the styloglossus. The stylopharyngeal muscle, which is the deepest muscle here, and the stylohyoid muscle, which almost above the posterior belly of digastric. That's in the posterior belly of digastric. The glossopharyngeal nerve is seen. That is the stylopharyngeal muscle here. That's glossopharyngeal nerve. You can see it very clearly here, coming from the deep aspect of the stylopharyngeus to become along its lower border, to be along the posterior border of the hyoglossus. That is the hyoglossus muscle here, where it will go between the middle and superior constrictor to the wall of to the cavity of the pharynx. So that is the glossopharyngeal nerve, and that is the way you can identify in the cadaver. That is the lingual nerve here and here. That is the lingual nerve. That is the duct of the submandibular gland here and here also. You can find it this very small one. That is the duct of the gland. That is the hypoglossal nerve here and here. You can see the arrangement of these structures, the duct, the lingual nerve, the hypoglossal nerve at a lower level. So I can see those dissection are very, very good cadaveric specimen. You can orient the region of the submandibular region. That is the mylohyoid muscle, the cut edge over here, which will be covering, if you stretch it up, it will be covering those structures, the lingual, the duct, the hypoglossal nerve, the deep part of the gland, and that's what you can see in the sublingual salivary gland. So we have tried to show those layers by different means. Here, we'll try to show it again in some specimens and diagrams. That is the hyoid bone here, the lower level. That is the anterior bit of the gastric, here and here. That is the posterior bit of the gastric. That is the submandibular gland. And that is the mylohyoid muscle here. And that is the anterior facial, which we have seen it, with the posterior anterior division of the retromandibular with the common facial vein. That is the first layer. The second layer, we can see the anterior bit of the gastric. When we remove it, we'll see that is the fibrous tube attaching the digastric to the hyoid bone. And that is the styloid process, which gives origin to the three muscles. That is the posterior bit of the gastric. Those are the first layer. Then the stylohyoid muscle above the posterior belly. That is the hyoglossus, and that is the mylohyoid, which will form in the second layer. The hyoglossus with the deep structures, it will be the third layer, will be the fourth layer. Now, that is a diagram which shows some good muscles. Again, we're trying just to orient that part of the body here. So you got the stylopharyngeus, the three muscles coming from the styloid process. That is the styloid process, giving three muscles here. That is the styloglossus muscle on the surface of the hyoglossus. That is the stylopharyngeus, which will be deep to the posterior border of the hyoglossus. And this is the stylohyoid muscle, which usually above the posterior belly of the gastric, which have been cut or removed over here. That is the genioglossus muscle here, and that is the geniohyoid muscle over here. That is the hyoglossus muscle. That is the middle constrictor, and that is the inferior constrictor muscle of the larynx. But the cut edge here is the stylohyoid ligament here. That is the stylohyoid ligament and the three muscles, styloglossus, pharyngeus, and stylohyoid. That is a good diagram to show the relation of the muscles to each other. You can see the geniohyoid and the genioglossus deep to the hyoglossus, and the three of them are deep to the mylohyoid. You can see the three muscles of the styloid process with the ligament. You can see the superior constrictor above here, the middle constrictor here, and that is the inferior constrictor. So the three constrictors can be seen in that diagram here. Here is the last layer, or the last slide, which should show a group of muscles in relation to each other, and they are forming the last layer before we remove the superior, the middle, inferior constrictor to be in the cavity of the pharynx. So what we can see here is the glossopharyngeal nerve, the main structures over here. You can see it in relation to the stylopharyngeus muscle here. But you can see the posterior bit of the gastric cut edge to expose those. That is the other end of the posterior belly, and that is the anterior belly here. Then the stylopharyngeus muscle, which is the nerve, as we said, have a close relation to it, and we have seen it in a better way in a cadaveric specimen, coming from the undersurface of the stylopharyngeus to the lower border, and then go between the at the junction or the lower border of the superior constrictor, upper border of the middle constrictor to the pharynx. That is the stylohyoid muscle here, and that is the cut edge. That's the stylohyoid ligament, by the way, is very clear here, which extend from the styloid process to the hyoid bone. That is the hyoglossus muscle. That is the superior constrictor. That is the buccinator, with the trigomandibular raphe giving origin to both of them, which extends from the trigoid hamulus to the posterior part of the mylohyoid line. and that is the styloglossus muscle on the surface of the hyoglossus. That is the mylohyoid muscle, and that is the end of the first part of the submandibular region. And in next session, we will describe the details of the structures which we have seen. So thank you. See you in the next session.